I'm Neomi Shah. I'm a pulmonary physician here, trained in pulmonary critical care sleep medicine. I'm a clinical sleep provider here. That's my primary role. I see patients with all forms of sleep disorders. I think sleep is unfortunately unrecognized. Sleep disorders are unrecognized, and sleep deprivation is a big problem, as I think most of us know. We don't get enough sleep. I think the magnitude of the sleep disorders and sleep problem and sleep deprivation is pretty large. I think as we get busy, there's less time for sleep, because what can you cut back on? You can't cut back on working. You can't cut back on taking care of your family, your children, your obligations. So it becomes very natural that people cut back on sleep. The problem with that is that it increases the risk for a lot of conditions, including obesity. We know that if you sleep less, you are at a higher risk for getting obese, which sort of drives the sleep apnea and the sleep disorders. But I think the other fascinating piece to me is the lack of awareness of how important sleep is, and this perception that I can live on 6 hours of sleep. Oh, I don't need more sleep, and because the body adapts to everything, but I think there is a price that we pay. So Mount Sinai has 2 sleep centers that operate, 7 days a week, and they would come in, they would spend the night where we would monitor their breathing, their heart, their brain activity, and other things, including full night video monitoring. We also offer home sleep testing, so for those patients that qualify and don't have advanced heart disease or advanced lung disease, they can get a sleep test at home, so they're not required to come into the lab, and it's more convenient, it's faster, and it's really appreciated by working patients, just because they don't have to take any time off. I think the biggest thing that I try to do is I don't watch the clock. So I am always there. I listen to them. I feel I'm a very compassionate person, and I really take the time with my patients. I treat them as if it was me or my family member.